Sars V2 Unfiltered. How does the COVID-19 affect our lungs and lead to the death of a person? My name is Sydney Ekwe and I will be presenting this. How does COVID-19 affect the overall respiratory system short and long term? So let's start with the compelling reason I chose the topic. SARS-CoV-2, a continuous worldwide virus with a large spread, has led to the death of millions of people. This is regarded as a hot topic for doctors, researchers, medical personnel, and families as they take each step, each hour, each day, each month to make a cure for this virus. This not only caught my attention but happened to one of my family members. That is why I decided to dig deep into this topic and to see what this topic is more about. Introduction. SARS-CoV-2 is a kind of mRNA virus. Because of the lack of mismatched pair mechanism, the virus replication process is combined by a high mutation rate. Therefore, the mutations of the coronavirus are consensual and predictable. Recent research shows that three novel variants, B.1.1.7, B.1.3.5.1, and B.1.1.2.8.1, have rapidly spread worldwide, causing concerns about the prevention and treatment of COVID-19. Now, in this diagram that we see over here, the variant emerged with multiple mutation sites, including 6 synonymous mutation, 13 non-synonymous mutation, and 4 depletion mutation. As we move on to background, coronaviruses are common causes of usually mild to moderate upper respiratory tract illnesses like the common cold, showcasing symptoms like runny nose, fever, sore throat, cough, or a general feeling of just being ill.
7 will be our high today. It'll be hot and dry.
Sam, what's wrong?
I'm cold.
You're cold? Oh my god, okay, let me give you over-the-counter medicine. Okay, take water. Quick, take water in there. Okay, now drink it. You'll be okay, okay? Okay. Oh my god. Oh, Sam, you okay now?
Oh yeah, I'm okay. I'm about to do some TikTok. Those medicines really helped.
Okay. However, a new coronavirus named Severe Acute Respiratory Syndrome Coronavirus 2, which is SARS-CoV-2, emerged and spread to cause COVID-19 pandemic. Now, the COVID-19 virus starts by invading the cells in our respiratory system, so our lungs are the first thing to be affected by COVID-19. COVID-19 seriously damages the cells and tissues that lines our lungs, and this has a huge impact on the way our lungs are able to function. This can harshly affect pre-existing conditions that a person may already has, such as asthma, intestinal lung disease, and other conditions, making it worse and is extremely dangerous. Pneumonia. Research shows that illnesses tied to COVID-19 was originally called novel coronavirus infected pneumonia, NCIP, but then it was later renamed as the coronavirus disease 2019. Early signs of COVID-19 are fatigue and chill, nausea and vomiting, diarrhea, belly pain, muscle or body aches, a headache, loss of smell or taste, sore throat, congestion or a runny nose, pink eye, and skin rashes. You still cold? You still cold? What's happening? Your stomach? Oh my god. You okay? You okay? Oh, what? What's no. Oh my god. Oh god, I'm reading in the news. They said sore throat. You have sore throat? Oh my god, try to smell this. It's not helping? Oh my god, I think you have COVID. Oh my god, where's the man? Okay, taste this. Let's see if you have taste. Taste anything? Not taste anything? Oh my god, you have COVID. I'm gonna go call 911. Pneumonia. What if COVID-19 infection starts to cause pneumonia? A person may notice things like rapid heartbeat, shortness of breath or breathlessness, rapid breathing, dizziness, heavy sweating. Now, the factors in coronavirus lung damage. Gliatators state that there are 3 factors that affect the lung damage risks in COVID-19 infections, which is 1. Disease severity. So cases that are not really severe are low to cause lasting scars in the lung tissue. 2. Health condition. Aged people are more subdued to severe cases of COVID-19. Yes, this is because their lung tissue are less elastic and weakened immunity may be inflicted to them. Treatment. A patient's recovery and long-term lung health is going to depend on what kind of care they get and how quickly they get it. When the hospital is more prompt to deal with severe ill patients, it can minimize lung damage. Now, what are the short-term effects of COVID-19 on the lungs? A recent survey showed that only 65% reported a return to baseline health by 14 to 21 days after diagnosis. Symptoms that persist include cough 43%, fatigue 35%, and rarely fevers and chills in those with prior mild infection. Now, in this image that we see here, we see a CT scan of the chest showing multifocal ground glass obtrusions with intermixed solidification from COVID-19 bronchial pneumonia. So this is the lungs, and we can see all this thing happening to the lungs. Now, the second image picture shows the CT scan of a chest showing multifocal ground glass obtrusion with intermixed solidification from COVID-19 bronchial pneumonia. So the same thing as the first one, but just a little bit more enlarged. Now, the last picture shows a CT scan of a chest interpreting the multifocal ground gland obtrusion from COVID-19 bronchial pneumonia. Now, this is not an intermixed solidification, but just on its own. So now, can you be affected with SARS-CoV-19 more than once? Many people have asked the question, and this is the answer right here. Now, research doesn't say how long COVID-19 lasts after initial infection, and particularly in cases of mild disease which may not generate an robust immune system. But there are reports of patients becoming reinfected, but the severity, which is the way it affects them, is not very large. As the vaccination are being taken, people who participate in taking the vaccine are generating neutralizing antibodies, while more research is still being undertaken. Heavy exercise or not? Should you exercise more after COVID, or should you not exercise more after COVID? For at least 7 days, avoid heavy exercise. If you do try to work out and it worsens your coughing or chest tightness, slow down and give yourself a few days of rest before trying again. Now, hey, welcome home. You okay? You feeling better now? This is for you. Take. Okay, come inside. Still have to do some 6 feet, but you know. Now, the mask is still essential, so make sure that you still have, whether you're recovering from COVID-19, whether you have COVID-19, whether you've never had COVID-19, always make sure to put on your mask when you're outside your home. Together, we are in this
to put an end to this pandemic and return back to normal. And still wear your mask, practice social distancing, and we'll be good.
Now, here are some graphs relating to COVID-19 in the past years and in recent years. Now, this first graph shows us the country distribution of COVID-19. We see the United States has the largest case studies with 87,284,377. Second by India, Brazil, Italy, and Turkey. These are very large numbers. Now, in this image right here, we see the cumulative number of deaths that has occurred in different countries due to COVID-19. This is a lot of deaths. We see the United States is still high in the chart. Then we see that the United Kingdom follows the suit. Then Spain, then Russia, then Iran, then India, and then Brazil. This is worldwide. Now, here in this image here, we are seeing the total outcomes of cases, comparing between people who have died and ones who have recovered. Thankfully, the amount of people who survive is a lot higher. The green is for recovery rates and the orange is for death rates. Now, in our last two images, we see a table on the left hand side and we see a table on the right hand side. Now, in the left hand side, the table shows a 0% change in the deaths due to COVID-19 in the year 2022, which is recent data. And now we see in the right hand side, the last 2 years, there were large amounts of constant and non-constant change in the total amount of change in deaths. So we are very, very glad that we are seeing a low amount of deaths right now in the year 2022, but past then in the year 2020 we saw a 20%, a 12% chance, a 14% chance, a 15% chance of constant deaths. This was not good at all. So this graph shows us that we are having a good number of people who are recovering rather than dying from COVID-19. And that comes to an end of my presentation. These are my reference pages. Thank you and see you again.